What is corrective chiropractic care? Have you been searching for answers to your chronic spinal condition, whether it's an L4, L5 disc bulge, an L5S1 disc bulge, a cervical neck disc bulge, or leg pain, arm pain, and you came across the words corrective chiropractic care? In this video, I'm going to dive deep into giving you the answers to 9 questions to make this a definitive guide of what corrective chiropractic care is and how it can possibly help you. Hi there, I'm Dr. Walter Slubro, a corrective care chiropractor in Vaughan, Ontario, Canada. What this channel is about is giving you tips and strategies on how to strengthen and stabilize your back. Like this, you can bend, move, and lift normally in your day-to-day life, free of pain and limitation. I also introduce my viewers to corrective chiropractic care, which is what this video is about. I'm advanced trained in chiropractic biophysics right here in Vaughan, Ontario, Canada. So let's dive into these 9 questions. But before I do that, be sure to subscribe to this channel. Like this, you get more advanced tips on how to strengthen and stabilize your spine and live a normal life again, free of pain and limitation. So we're gonna do this in a question and answer format. And the first question is, what is corrective chiropractic care? So that's a term that we use to describe a type of advanced chiropractic care that works on global corrections of spine and posture. Now, the technique that I specifically use is called chiropractic biophysics. There's over 350 peer-reviewed publications behind chiropractic biophysics. So when I'm mentioning corrective chiropractic care, that's what I'm talking about in this video and in my videos and on my channel. Now, corrective chiropractic care, what's going to be required first is an assessment of your posture, so your body position in space. We know what normal is. We're going to see what your posture is compared to normal, and then an assessment of your spine with an X-ray evaluation, a full spine X-ray evaluation from the front and the side. So let me just give you an idea, just to kind of get you started with understanding this. So we know that the spine should be straight from the front and have 3 natural curves from the side. So the neck is geometrically shaped as a circle. It approximates the shape of a circle. The mid-back approximates the shape of an ellipse, and the low back approximates the shape of an ellipse in the opposite direction, and they're in balance. Okay, so head is over shoulder, shoulders over lower back's over pelvis. Okay, and then from the front, the head is right over center between the pelvis. Okay, now what happens when the spine shifts out of alignment? So let's say the head is going forward. Okay, that's a forward head translation. Or there's a kyphosis, a reversal of the neck. Or there's a hyperkyphosis in the thoracic spine, or a straightening of the lumbar spine. These are all abnormal spinal alignments that's been shown in clinical, day-to-day visits with my patients, and also in research and case studies that will cause, in the long term, degeneration on the spine and discs, compression on the nerves, and lead to conditions like disc bulge, disc injuries, spinal arthritis and degenerative disc disease, pain, limitation, all sorts of things that limit people because of spinal conditions, okay? So I have a whole bunch of videos on my channel about that. So let's say we find someone that has a forward head position or a hyperkyphosis, right? So that's their position. So the aim of corrective chiropractic care is to improve the global positions of the body, so improve posture, and then also improve the alignment, right? The alignment. So if someone's head is forward, we apply techniques to bring it back into a better position. If someone is hyperkyphosis, we apply techniques to bring it back into a better position. So corrective chiropractic care aims to improve the global positions of the body, which is abnormal postural positions, and then the global positions of the spine in terms of bad misalignment to the spine. And the basic premise of corrective chiropractic care and chiropractic biophysics is mirror image techniques, is finding what the patient's position is in and then applying mirror image techniques. And there's 3 protocols to mirror image techniques. And mirror image has been trademarked and coined by chiropractic biophysics. And what this means is that if someone's position is forward, the mirror image technique would be to bring it back in the opposite position, right? You want to overcorrect during the treatment process, and then eventually it finds the happy middle position. So 3 protocols to chiropractic biophysics or corrective care. And number 1 is mirror image exercises. So again, someone has a forward head position. We train them to do exercises in the mirror image position, hold 10 seconds, repeat them 20, 30, 40 times, the more the better, and the body finds the middle happy position to improve that posture. So the mirror image exercises helps to improve the muscular strength and correction of the posture. Then there's mirror image adjustments. I can take someone's neck and head position, put it back into overcorrect the position, use a drop table or instrument, and then apply specific taps or adjustments in certain areas of the body that has a high concentration of mechanical receptors that feeds good information to your brain about the new position, and the body's neurology begins to reset and re-educate that position into a better position. Okay, so that's mirror image adjustments. Then there's mirror image traction setups. Okay, so traction setups would be to help reform the ligaments. So if someone's head is forward, there could be ligaments that got reformed in that position to go forward in the upper back, or if someone has a kyphosis, right, the ligaments got reshaped over time. So we want to put them on some kind of traction device in the office or at home that helps to rebend that position, hold it there for anywhere from 12 to 20 minutes to get that ligament creep changes in there, to get sustained change in there that will hold over time, and eventually the spine will relearn that new position. So a combination of mirror image exercises, mirror image adjustments, and mirror image traction techniques is what encompasses a corrective care protocol. Question number 2, what conditions can be treated with corrective chiropractic care? So most conditions that relate to the spine and to abnormal posture can be treated with corrective chiropractic care. So let me just rattle off a few of the ones that we normally treat in our office. So conditions like disc bulges in the lower lumbar spine, L4, L5 disc bulge, L5S1 disc bulge, disc herniations, disc protrusions, disc bulges in the neck, C5, C6 disc bulge. Some people come in with complaints of pain, low back pain, SI joint pain, buttock pain, leg pain, sciatica, radiculopathy, numbness, tingling in the arms or legs, tight muscles in the shoulders, bad posture, just people come in generally to correct their posture, scoliosis, stenosis. These are the many conditions that we see in our office that we've successfully treated with corrective chiropractic care. Question number 3, how does corrective chiropractic care work? So I already answered a lot of that in question number 1, so feel free to go back to that, but I'll review it again here. So the number 1 thing is an accurate assessment of your posture and spine. Now we use an app called Posture Screen to measure someone's posture. We take a photograph, front view and lateral view, and then we get some measurements of their posture, and we can do before and after pictures. And then of course we use digital x-rays to get a full spine image of the spine, neck, mid-back, low back, front, and side, okay? And with that, we take a consultation and do other examinations to make sure the patient qualifies for corrective chiropractic care, okay? So it also involves checking to see if there's abnormal posture patterns or abnormal spinal alignment patterns, and then applying mirror image corrective techniques to bring it back to a better position, okay? So I talked about this earlier, just to review again, and I'll give you a different version of now. So let's say someone comes in with neck pain, upper back pain, right? The spine should be centered down the center, and let's say that I see their posture is off to the side, which was very visible with the naked eye and also through photographs. And on their x-ray now, they have a shifting of their thorax like this, or the neck is shifting. So the aim of corrective chiropractic care is to bring that posture neutral and bring the spine back to neutral. And we apply mirror image techniques. So there's exercises, lateral translation exercises this way to strengthen the muscles, right? To improve that posture. There's adjustments. I can apply adjustment forces with an instrument or with a table to bring the spine to the opposite mirror image position. And then there's traction. I can set up a translation traction with our equipment to bring the spine in this position, like that, eventually reform those ligaments to find that neutral position. Okay, so we apply mirror image chiropractic biophysics techniques to improve the abnormal posture and the abnormal spinal alignment. So that's how corrective chiropractic care works. Question number 4, what are the benefits of corrective chiropractic care? So one of the biggest advantages that I find as a benefit of corrective chiropractic care is that it takes spinal care to the next level. So traditional chiropractic care is amazing, right? I do traditional chiropractic care all the time as part of our treatment programs. It involves specific local adjustments to the spine, neck, mid-back, low back, with ancillary treatments like exercises and so forth. But corrective chiropractic care takes it to the next level. It's talking about global corrections, like I mentioned earlier, okay? And the biggest benefits is improvement of postural positions and improvement of spinal misalignments, global spinal misalignments. And what's the benefit of that? Well, abnormal posture positions, right? Abnormal misalignments over time will either weaken the muscles, stretch the muscles and tendons, cause pain, cause disabilities, cause degeneration, right? That's degeneration on the discs, cause compression of nerves, and lead to pain and disability, right? So the biggest benefits is not just immediate relief of pain that comes with general chiropractic care anyways, but also long-term correction and stability for long-term permanent relief. A lot of times, patients stick around with us and we do follow-up x-rays and we see that the corrections we got in the initial care program, they're stuck, which means they held in place, or maybe they regressed a little bit, but overall they're better than the initial presentation. So we know that correcting the spine and posture with corrective chiropractic care has also long-term benefits, not just short-term benefits in preventing further disability or preventing the pain from reoccurring. Question number 5, is corrective chiropractic care safe? And the short answer is yes. In fact, chiropractic biophysics is backed up by over 350 peer-reviewed publications. I'll post a link below so you can go and review those publications. And there's many case studies, there's many clinical trials, there's biomechanical studies, there's x-ray studies, guidelines that have been published. So it's well researched, backed up for many years, and has clinical relevancy, and also it's very safe, okay? Of course, having said that, nothing's immune to risk, and that's with general chiropractic care, that's with physiotherapy, that's with surgeries, and also with medications. So we always do a consultation examination x-ray to make sure that the patient qualifies for any care, not just corrective chiropractic care. And if there is certain components in their findings, in their x-rays especially, like instabilities possibly, or if something doesn't fit the corrective chiropractic care protocol, then they don't qualify for corrective chiropractic care, and they may need other things to be done, okay? So we always make sure that the patient qualifies first before we proceed with any type of treatment. But having said that, it's very safe. Going through any type of treatment at the beginning, you might find some aches and pains, some sorenesses. It's like exercising for the very first time. But our patients love sitting in the traction equipment. They love doing their home exercises. They come out of our sessions feeling really, really awesome as they're continuing with the process. So it is definitely safe, and it's safe for all ages. I've had teenagers under corrective chiropractic care. I've had young adults, middle-aged adults, and even elderlies and seniors under corrective chiropractic care doing either our exercises or adjustments and also our traction methods. Question number 6, what can I expect during a treatment? So I'll give you kind of an outline of what a typical corrective chiropractic care program is in our office. We start off with 12-week programs. Why is that? Because that's what the clinical studies show, and you can go look it up in the link below on the CBP nonprofit research publication page, right? So anywhere from 10 to 12 weeks. And most people come in at 3 times a week, and eventually graduate them down to twice a week. So you're looking at anywhere from 32 to 36 sessions, more or less, in the first 12 weeks, okay? Now I always start people off with traditional chiropractic adjustments, get their spine moving, get that initial tightness reduced, and also any inflammation and pain at the beginning that they're coming in with. We try to get it reduced as much as possible to get them to tolerate the corrective protocols as soon as possible, okay? So we don't jump into corrective chiropractic care right away. And that can vary from person to person. Maybe the second week they start corrective chiropractic care, the third or fourth week. We always go to the patient's abilities and tolerance, okay? And then once we are done with that initial kind of relief type care the first couple of weeks, we still continue with traditional chiropractic adjustments in my office, and then I start moving people on to corrective chiropractic programs, okay? So we do in-office structural rehab in our office, and I also send home with patients home with traction units, okay? Some of the traction units we use are called Beneral, which are designed to traction the spines and are easy for patients to use at home as well. I have many videos on my channel that show you examples of these, okay? So the in-office patients will do their mirror image exercises depending on the level that we're working on. Sometimes it's more than one level, and then they'll get their chiropractic mirror image adjustments, and then they'll get their mirror image traction setups. We have specific CBP approved traction equipment where we get people to either traction their neck or even full spine setups. We can do them seated, we can do them lying down. So we have a variety of different ways to do that in our office. So they're monitored, they're supervised by me or my staff, and people are also sent home with corrective care exercises, postural exercises, and also traction exercises to be done at home. The beauty of the home traction exercises and programs we give is that in our office, people are coming at 3 times a week, but when they get the home kit, they're now doing something on those off days as well. So now they're getting an intervention of corrective care onto their spine and posture every single day of the week, right? So the more repetition, the better success, okay? So it's kind of an idea of the program. Now, we don't just go ahead and haphazardly treat someone without any follow-up, right? Month 1, I do a follow-up, month 2, I do a follow-up, and then month 3, I do a follow-up. We take posture photos, we do range of motion, different tests along the way, and then on the third one, I do a x-ray evaluation and compare before and after and want to see what's going on at that point. At that point, someone may need more corrective care, or we just transfer them over to maintenance care if they choose. Okay, maintenance care could be once a week, once every 2 weeks, or once every month, whatever suits the patient's needs. Of course, we give patients functional exercises as well, but we start off with structural exercises first, and then we move into other strengthening exercises further back, like core, plank exercises, and so forth. So it kind of gives you an idea of a corrective care program in my office, what it entails, okay? How long does it take to see results? That's question number 7. Now, of course, results will vary from patient to patient and from case to case. So I can give you generalizations that I've seen in my office for the last 24 years, okay? And results really comes to 2, maybe 3 main categories. 1 is pain, okay? Relief of pain, the main thing that brings people to our office. 2 is functional improvement, and 3 is then the structural changes that we see on x-rays, okay, and posture, okay? So typically in the first 12 weeks, I see people's pain improvement reduce anywhere from 50 to 80%. So a 50 to 80% reduction of pain in the first 12 weeks. Of course, there's those people that have more pain improvement, as an outlier, and then there's those more people that have less of pain improvement, depending on the case, okay? That's kind of the average, and that's pretty realistic when it comes to chiropractic care in general. One of the things that kind of is interesting that I find is that we get patients that have come to us after other forms of treatment have failed them. They've tried physio, they've tried traditional chiropractic care only, they've tried exercises, medications, injections, you name it. And the only thing they didn't try was corrective chiropractic care. So they've been suffering with these symptoms for many years, right? And then we start to introduce our program that includes corrective chiropractic care and chiropractic biophysics, and then they begin to see these results in the first 12 weeks, okay? 50 to 80% reduction of pain. Again, that's a generalization that I've seen across the board. It may not be applicable to you specifically if you were to come into my office, but that's what I've seen. So in many cases, the one thing that was the difference that patients got in our office, or an office like ours that does corrective chiropractic care and CBP stands for chiropractic biophysics, that they didn't get in another office or another place, is the corrective care component, okay? And then the other part is functional improvement. So as pain reduces, right, then people's function improves. Walking, standing, bending, lifting, sitting at the desk or in the car, right? Sleeping, going to the gym, handling your kids, doing house chores, right? Recreation, going for a walk. All these things are important daily activities of daily living and functional changes that we've seen. And we score these things with questionnaires that we give our patients at the beginning and at every re-exam. Their pain scores decrease and improve, and their health status scores increase and improve. So we can monitor this along the way. So it's pretty cool. Then the third thing is structural changes, okay? Now the structural changes, when it comes to posture, we take before and after pictures on our Posture Screen app, and I do see at least 80-90% of our patients see some form of postural improvement, right? But then it comes to spinal changes, okay, that we see on x-rays. And that realistically is the hardest thing to change, okay? Many people come in with chronic spinal conditions and misalignments that have been with them for 10, 20, 30, 40 years, as evidenced by the amount of arthritis degeneration on their spine. So it's unrealistic to expect that to improve and change dramatically in a matter of weeks or even months. So sometimes people may need 1 course of care, sometimes they need 2 courses of care or 3 courses of care, and it's been shown by many case studies, in CBP and also corrective chiropractic care. So if we get people out of pain, 80-90% reduction of pain, they're improving their function and quality of life. And even if this just stayed the same, that's still a great result, okay? But 20, 30, 40% of the people will see some structural changes even in the first 12 weeks, okay? So that's kind of a guideline, okay? And if someone can actually use more corrective care after the first 12 weeks, then we apply more corrective techniques if they're willing to do that. So you're probably wondering right now, question number 8, how do I know if corrective chiropractic care is right for me? And the only way to know is by getting an examination with a corrective care chiropractor, one that's trained in chiropractic biophysics. And wait, in a moment, I'm going to give you a referral directory where you can find one in your area. So the best way is an examination. You won't know unless you get assessed by a qualified, trained corrective care chiropractor, chiropractic biophysics chiropractor, okay? And in that experience, what I expect you to receive is a consultation, a case review if you bring in any medical reports or imaging reports, postural evaluation, and an x-ray evaluation. And then I don't jump into care on day 1. I look at all the results, look at the x-ray analyses, take my time. Patient comes back in a couple days for their results appointment, and I review their x-rays compared to normal and give them a little report that they can take home with them as well. And in that analysis, I can determine if you would qualify for care. So sometimes people qualify for all care, sometimes they qualify for parts of the care. So they may be able to do exercises and adjustments, but maybe not the traction because of how things are set up, okay? So we want to rule out any contraindications, okay? Any contraindications, whether they're red flags and sometimes even yellow flags, things that are relative contraindications, okay? So that's the best way to determine if you qualify for care. A lot of times people send me their x-rays, their MRI reports, ask me a bunch of questions on my YouTube channel, and I'll answer them to the best of my ability. I can't give you a clinical impression because I haven't examined you. And I'll always say the best way to know is by getting checked by a corrective care chiropractor, okay? So that leads me to question number 9. How do I find the corrective care chiropractor? And what I want you to do is just comment below. Okay, I want engagement on this video. Comment below if you want a corrective care chiropractic directory, a directory of trained and also certified chiropractic biophysics docs that do similar work like I do. Comment below and I will type out for you a directory that takes you right to the CBP doctor directory. And there's many across the United States, there's many across Canada, and even other parts of the world like in Europe, okay? And always look for one that's trained, and then if you can find one that's certified, you can check that as well, okay? You now have a comprehensive guide on corrective chiropractic care. 9 questions answered. And of course, if you have any other questions, leave them in the comments below. And remember to ask for the Chiropractic Biophysics Doctor Directory. Now it's your turn. I want to hear from you. What's been your journey with spinal care? What conditions have you been suffering with? What have you tried that's worked for you? What have you tried that has not worked for you? Comment below. Share your story. By sharing your story, you're actually going to help other people that can relate to you. So let's build a community that's very supportive on this channel, okay? And share and like this video with others. So like it so it helps with the YouTube algorithm, and share with someone that you think may actually benefit from it, okay? And lastly, don't forget to subscribe because I want you to receive more videos. I'm going to create a series of videos for corrective chiropractic care for specific conditions. So corrective chiropractic care for disc bulge, corrective chiropractic care for sciatica, corrective chiropractic care for hyperkyphosis. So come back to this channel every week because my next series of videos will be corrective chiropractic care for specific conditions, and I'll show you some demonstrations on how I do that. And lastly, I want to point you to another video where I actually show you the specific techniques of adjustments, exercises, and even traction for corrective chiropractic care, chiropractic biophysics that I apply to cervical kyphosis. So go ahead and watch that video right here, right now.